which we call the CHIP, and develop a revised 3-year CHIP. To be meaningful, the CHIP process must include broad participation of all the community partners. And that's what everybody in this room represents. Even though the collaborative was a very instrumental piece of putting together the CHA, it took community input to set these priorities. And based on the issues and themes identified in the CHA, include a prioritization process to help us determine what key issues are most important to address, and also why. The CHIP process results in a working document that will identify key health priorities, measurable objectives, evidence-based improvement strategies with measurable and time-frame targets. Policy changes needed to accomplish health objectives, clearly identified individuals and organizations that will and have accepted responsibility for implementing these strategies, as well as measurable health indicators to monitor the progress. This plan should also align with the Metro Health Strategic Plan, to which we are developing now. It's going to be a 3-year effort as well, a 3-year plan that also is going to look at social determinants of health through a health equity lens. Also, the CHIP should be in alignment with other local plans, such as the SA Tomorrow that was announced by City Council about a week ago, as well as state and national priorities. Thus, this is not a standalone or a do-alone process. We need everybody's participation. Given that, before leaving today, we're actually asking you to sign up for either individual or an organizational work groups. Now, how we set up the priorities right now, is that key priority areas, work groups as we envision right now are 1, healthy eating and active living; 2, healthy child and family development; 3, safe communities; 4, behavioral and mental health well-being; 5, sexual health. Now, that doesn't necessarily mean that's all of the priorities we're going to have, all the work groups we're going to have, because we expect and we encourage the community to lead us into some other efforts that might be really important. If you look at today's newspaper, there was an interesting article in regards to maternal morbidity and mortality, as well as a few weeks ago there was an article in regards to prenatal care in San Antonio. We also lead in those efforts in a bad way, but nevertheless, that could be some of our priorities to which we want the community, if they so choose, to be priorities to address some of those. Metro Health, starting in October, we're developing an Office of Health Equity so that we can address these things in more depth. And I think at the end of the day, this is this CHA and the CHIP will be an opportunity for primary care and public health to actually work together. And I think it's the opportunity that we can actually embellish and help the community, because these, everything they mentioned throughout this morning are very complex issues that's going to take more than just public health, it's going to take more than just clinical medicine, it's going to take more than just the community. And I do like the one slide that they had in the box, community development. I think the community is our priority. We, in public health, work in population health. Even though we certainly care about an individual's health, but that individual is part of a larger community. So we look forward to working with you. If you want to volunteer today, go back and get your group together to volunteer, your organization to volunteer. We welcome your addition to this process. Thanks.
Dr. Nathan, thank you. You know, this is the biggest charge of the morning. What is this call to action that we have, all of us, daily? It is outlined for us in the CHNOP today, in the salient findings. But really what it takes is us working together. We have for you a very, very brief, 90 seconds, a minute and a half video that is your takeaway this morning, along with the other tools you've been provided, glossary of terms, the executive summary, the wonderful portal that we talked about, that Dr. McKieran talked about. But we want you to really walk away this morning and be, as Dr. Ferrer said, that person that makes a difference. We want you to remember in these next 90 seconds, what are the issues so that we, working together, can make that difference. We will grow healthy together. And so now, here's that takeaway. Here's this video that we want to thank Intralex for providing.
San Antonio and Bexar County are experiencing rapid population growth that will add 1 million people by 2040. Almost 100,000 more children will be enrolled in schools, and for the first time in history, the population over 65 will equal that below age 17. The majority of Bexar County residents are Hispanic, about 60% in fact, and are mostly young. However, in the coming years, the population pyramid will shift as Hispanic youth reach adulthood. Rapid population growth, changing demographics, and environmental transformation can be challenging to our community. But these same challenges also present opportunity. Local access to recreational facilities, parks, and pathways have improved, but public transportation, poor air quality, and neighborhood walkability have remained constant or gotten worse. A person's health is greatly affected by their physical and social surroundings and influences their ability to make healthy decisions. The health issues these adults will face are heavy burdens of high blood pressure, cardiovascular disease, and diabetes, ultimately challenging their health and decision-making as they join the workforce. Obesity in Bexar County is among the highest in the U.S., and as citizens of Bexar County, we must instill proactive efforts in our government, local businesses, and financial sectors to promote healthy opportunities. We cannot stop progress, but together we can shape it. That's why the Bexar County Health Collaborative urges everyone to become part of the Grow Healthy movement, to thoughtfully consider its community health needs assessment and participate in its community health improvement plan. Together, we can grow healthy.
So at this time, we're going to take a quick second to ask anyone who has a question. We have two people out. I've got Caroline right over there and then Lena on the other side of the room. Does anyone have questions about any of the information, or maybe you have a comment that you would like to make with regards to the information that was presented today? Just want to raise your hand. So we have a question right over here. And I'll invite Dr. Ferrer and Dr. Blanchard to come up in case there's any questions regarding our data sets.
Good morning. Maybe I missed it, but the first chip that we had in 2014, what did we do with that? What have we done with that? We're starting a new chip.
We are continuing the CHIP process. So what happens after the community health assessment is that we formally organize the work groups that are going to continue the work that we started back in 2012. And so after every health needs assessment, we go back to the CHIP work groups and we look at all the information we take. We take the new data from the health needs assessment and then we revise the community health improvement plan, whether that be adding, whether that be changing, whether that be making new recommendations on the strategies. And so that's the process that Dr. Nathan was talking about. So the CHIP is still part of, it's the second phase to what we're doing. It's never forgotten or lost. As a matter of fact, it's implemented, it's used in order for other community stakeholders and businesses to implement some of those strategies and test those. So when we come together again after this phase, the work groups will come together and you're asked to sign up in the back of the different work groups. But right now we have those 5 priority areas, like Dr. Nathan said: mental health, behavioral health, sexual health, healthy and active living, safe communities, and healthy families. Through this next CHIP process, we will look at the data from the community needs assessment, and based on community voice and input, if there is another area that we need to impact or we need to start looking at, that's where the work groups really come together. We'll be looking at what has happened since we looked at that CHIP or since we revised that, what partner activity has happened where we've seen changes, what strategies made sense at the time, what doesn't make sense anymore, and sort of what changes in the landscape will allow us to create new strategies or to form new partnerships. So that is something that continues to be a living piece of planning for our community, and that's where we really leverage a lot of the resources and talent skills from our community organizations, and we do that in partnership with Metro Health so that they also can help us form a citywide approach.
I just want to thank you. Is this on? I just wanted to add response to your question. The Community Health Improvement Plan is a long-term process. We don't make change in 3 years, really. What is underlying those indicators and needles we're trying to move are behaviors and infrastructure development. And those are not overnight changes. So we may have the 4 or 5 dimensions in a Community Health Improvement Plan. We may decide that we want to go another 3 years, another 6. Some of these things are going to take a generation of change, and we have to be patient. So we'll be probably over the next 2 or 3 CHIPs and assessments be looking at a lot of the same issues and hopefully seeing changes, improvement as time goes by. So 3 years, we've kind of given ourselves a difficult prospect of thinking, well, we do this now and we'll see change by 2017 with what we did with the 2014 CHIP. Not likely. These are long-term, we just have to be patient with it. So, thank you.
Is another question? Anyone else?
Hi, great job on the data. Lisa Jensen, Executive Director for NAMI. One of the things I wanted to ask is, how are you going to roll out this information to the San Antonio community? PSAs? I'm particularly concerned about the high suicide rate that we're experiencing, and if you could just address how you're going to get the word out. To me, the suicide rates are an epidemic and need to be addressed. Thank you.
So Lisa, great point. First, I'll say that the opportunity for us to share this information is ours. It's every one of you. So soon after this meeting, you will have access to the full report online through the Health Collaborative website. You will also have access to the executive summary that you received here in PDF format, and we've also done a Spanish translation to the executive summary. So those documents will be available for you to share, to download, and to send out. Now, the piece about sharing the data or the information on there is something that we take to heart, and that's really going back into community and talking to families, talking to partners, talking to policymakers, and really getting this information out. I'm going to share with you, and I think Dr. Ferrer already mentioned this, but I will tell you that the user group for the Community Health Needs Assessment is not something that is just done by the hospitals. Although this report started from a requirement for hospitals to do that, and Dr. McCurran talked about this earlier, Bexar County is a step ahead in a lot of different ways. We are one of the only, well actually we are the only collaborative that does this report with community and for community. So while hospitals can take this information and use it for their required IRS filings, this report is shared with everyone and anyone that needs it. We had over 7,500 users in the 2013 CHIP, excuse me, Community Health Needs Assessment, and I will tell you, a large majority of that is nonprofits. Many nonprofits, many of you guys know that the report is not something that's really inexpensive. It is an expensive process to go through. But the Health Collaborative, along with partners like the United Way, Bexar County, and even the Gronkowski Charitable Foundation, we raise these funds in order for this report to be shared and to be given to you as community partners. So the idea of providing this information to community, it's really with all of us here. We encourage you to download the report. We encourage you to send it out to your friends. We encourage you to take pieces out of this information and use it for your own service needs. Use it for your own programs, because that's what this information is there for. Any other questions? I think someone else, oh, we have someone over here.
First, my name is Catherine Velasquez. I wanted to, commend the Bexar County Health Collaborative for all the work that they do, and I think you really reach out and try to touch a lot of different parts of our population, especially those that are underserved and are experiencing disparities. And I love the CHIP. I've been involved in that process along too, and I think we have great strategies. We've split it into great goals. But I'm thinking about that pie chart that we had in there about social determinants of health, and that 55% of, I guess, the disparities are because of those social determinants that are not clearly spelled out or addressed in the CHIP process. And so I'm wondering how we can address that in the CHIP, or just as individuals. I'm thinking we're going to have to do more than what we've done in terms of advocating and even politicizing and possibly alienating, I guess, some people in politics or in power to do that. And so I would ask you to address that, and I would also encourage anyone who's working on the CHIP to think in terms of equity and social justice, and possibly, offending some people who don't think that's things that we should be doing.
Great comment. Thank you so much for doing that. And again, that is exactly what we want to hear. Through the process of the Community Health Improvement Plan, that'll be next phase. We're going to be thinking about and asking for your voice as to how we do the CHIP next. What are some of the elements that need to be included, and how do we look at this information and talk about those very tough pieces, right? Who needs to be included, who we need to connect with. But I think at the same time, there's another opportunity that'll be forthcoming, at least something that the Health Collaborative has been working on with the leadership here, and that's about how we continue to talk about the investment in health. And what does that mean, and what does that look like, and how do we make some of these things very sustainable? So there's a couple of different opportunities I think they'll be coming forward, but more so is that we need to have you engaged, and we need to have you in the conversation to shed light on some of the things that you've already been thinking about, and to honestly, I think, put a challenge out there, not just for us, right, but for everyone that's sitting in this room, of what can we do and what can we do different. Anyone want to ask?
Yeah, thank you for that comment, Catherine. It's good to see you. And I'll just add that, we're on this. We definitely realize that there's a lot of work to be done really across sectors, and one of our other tag phrases as we go forward is going to be health in all policies. So we've got to think about education policy ultimately as health policy, and employment policy, and living wages, and food systems, and all that. So to accomplish those things, we've got to get under the nose of policymakers and politicians. And also, ultimately, to see improvements, we've got to invest, so we have more resources to give to the communities that need it the most. And so this fruit isn't ripe yet, but we're actively growing. I'm trying to use this metaphor. We're actively growing an initiative to have a viable and vigorous pathway towards increasing investment in public health and community development in Bexar County, and stay tuned for that.
Any other questions? We have one in the back.
I live in and work on the south side in mental health, and have only been in the community for that period of time. And I was on a collaborative community thing in PDOT in terms of mental health. It was really hard among my colleagues to put poverty as one of the factors that really influences mental health, which was pretty shocking because the person comes with the therapy, the totality of who they are. What I'm curious about is maybe in these 5 or so groups that are gathering, is there a possibility to invite groups like COPS Metro and others that do community organizing to be part of the planning with us? I have an assumption here that most people are focused on health, as it does say health collaborative. But can we widen the circle to get the other folks from different perspectives to be part of this? And I'd like to feel Dr. Farrar take him to every single health meeting and school of nursing and doctors, and have them bring his spirit and his insights into what's in the reality of a person beyond just the foot, the ulcer, the whatever. And that he really embodies that kind of holistic health. And I'm delighted that he's at the Green.
Thank you. So you just gave me a great fundraising opportunity there. So anyone interested, please see me after the meeting. But definitely, I think encouraging or increasing participation in that health improvement plan is vital in order for us to change that conversation. It's bringing those partners that we know have a huge opportunity to help and support our families. So part of the work that we'll be doing with Metro Health over the next phase is including this recruitment process and really being out in front, out in the public, contacting each of you that are here today, and I will say aggressively recruiting you to sign up for those health improvement plan meetings and to help us gather the resource or the talent of others that should be at the table and maybe haven't been present. So many of you may become ambassadors, may become chair people for some of these work groups to really help us bring other talent into that think tank. Okay, any other questions? Okay, well now I'd like to introduce our our Treasurer Secretary, Ms. Terry De La Haya, and she's going to give a warm thank you to all of you.
Thank you, Elizabeth. I guess we could bid out Dr. Farrar to raise some money. I don't know how he feels about that. But I think Dr. Farrar is our chair of our Health Collaborative because he does embody exactly what you said. And I've never worked with a better group of public health advocates as I do in the Health Collaborative. Next year will be 20 years that the Health Collaborative has been organized. I've been a part of the Health Collaborative since its inception. That tells you how old I am. But certainly this has been really evolving through the years, and we put away our competitive spirit because we all represent the major healthcare organizations, and over the last 5 to 7 years, we've invited the YMCA and Carnot University and other organizations to be part of the Health Collaborative because we know as health systems, people come to us because they're sick. We want to work with you as a community so that you can help us keep them well, because we can't keep them well in the health system. We can help them heal. We can help them with their chronic disease. We can fix bones. We can provide trauma care. But what we don't do is what you do in the community. You have the front door. You get to see the people that we see way before we see them. And we want to work with you to be successful. No one organization can do it by themselves. And that's why I think the Health Collaborative has such a great spirit in this community, because we finally have found a way to put that competitive spirit away and to really work together. On behalf of the Health Collaborative Board, I do want to thank you for being here this morning. But more importantly, I want all of the Health Collaborative Board members to please stand and be recognized for all the hard work that we've done through all the years. Please, you can please stand. Thank you very much. I asked Elizabeth, could you give me some talking points at the end? And I think she used font 2, and I really need a font 12. So I really can't read what is on here. But I will tell you that my role today is to thank you for your participation. I think in this, and most of our work organizations, we certainly can collect data. In fact, we've gotten better at analyzing data. But what we're not good at is executing action. And so here comes the next part. Today we've provided you the information. Still a lot of analysis needs to be done on it. But you've heard a lot of invitation for you to support the groups that we've put together. You've heard that action's not, it's gonna take place, but it's gonna evolve over the 3 to 10 years. So when that happens, people get discouraged. We start with 20 people on a committee, and within a year, we're down to 5. Please be patient with us. It's not, black and white. It's not going to evolve. You're not going to see, all of us want to see results immediately. This is not one of those actions where results come immediately. It comes with patience and perseverance, comes with determination, and so we need that from you all because we cannot do it by ourselves. And 3 years from now, if we come back and we show you the same data, the same stats, the same problems, something's wrong because we're not taking the action we need to take to be successful as a community. So again, please, we encourage your participation. I do want to thank not only our board members, but our staff members from the Health Collaborative. If you could please stand and be recognized, because they're the backbone of everything we do. Please. So again, thank you. Drive safely and please participate. Thank you very much.